Hello, my name is Barnick, and I'm here to talk to you a little bit about caesarean section today. There are two types of a caesarean section. One is an elective caesarean section, which is a planned procedure, and the other is an emergency. And the emergency caesarean sections are classified into 4 different types according to the degree of urgency. The operation itself, though, is exactly the same. And I thought I'd talk you through a little bit about what that entails. On arrival in the operating theatre, you would normally then meet the anaesthetist for your spinal regional anaesthetic, because it's very unusual for us to have to perform a general anaesthetic anymore these days. And depending on the type of regional block, either spinal or epidural, this would then be administered and we would wait for it to be effective. This is tested very carefully by the anaesthetist, who tests for the sensation of cold, which is similar nerve fibers to pain. Once we're sure that the epidural is working as well as we want it to, we then place a urinary catheter to drain the bladder, because this is important after the operation. And we then go ahead and prepare the skin for the caesarean. And we wash it with a strong alcoholic solution, which is antiseptic. We then stick on some sterile disposable drapes to cover the area and also to help collect any amniotic fluid that's going to be released during the caesarean section. We then make a transverse incision in the skin about 10 centimeters long, just long enough to allow us to deliver the baby's head. And we try and make this as low as we can on the anterior abdominal wall, so that it's beneath the bikini line and therefore won't show. Having cut through the skin, we then separate the muscles, and we do this by pulling the muscles apart so that we damage them as little as possible, and they can come back together again nicely after the operation. And having done this, we're then inside the abdomen and we can see the womb, and we can see where we're going to need to make our incision to deliver the baby. We put in some special retractors to try and keep the space nice and open, and we then go ahead with the actual delivery of the baby. We make a transverse incision in the lower part of the womb and stretch this again with our fingers so that there's a gap big enough to deliver the baby. The baby's head is then delivered with a combination of a little bit of manipulation and pressure on the upper abdomen to help to push the baby out through the incision. Sometimes we need to use a pair of Wrigley's forceps to do this, but obviously it's something we try to avoid. Now, as soon as the baby's head comes out into the air, the baby normally starts to scream or starts to take some deep breaths, and normally stretches out a bit as we deliver the baby. And this is a really lovely moment for both mum and her partner. And sometimes people take photos at this time because it's a great photo opportunity. We then put the baby down on the mother's legs, and we wait for the cord to stop pulsating before we cut it and clamp it and cut it. And sometimes we might get the husband to cut the cord at this time too, because that's a really special moment. Now, the baby can be given to the mother at this point if she wants to have the baby straight away for skin to skin. But of course, babies tend to be a bit wet, and we do want to make sure they don't get cold too quickly. So sometimes we dry the baby off a little bit before giving it to mum to hold on to and to cuddle. And again, this is a really special time. So we try to do this straight away and not bother with all of the observations and things that need to be done on the baby, which can usually wait until later. Now, once the baby's there with mum, both mum and dad tend to sort of not worry too much about how long the operation's taking anymore, but it does take about another 25 minutes to complete the surgery. We first have to deliver the placenta, which we do carefully. We swab out the womb to make sure there's nothing left inside the womb, and then we then close the womb in 2 layers. Having done that, we then close the muscles back together again a little bit where we've stretched them, and we then put a stitch in under the skin in the fat to bring that together, and then a stitch under the skin ultimately to close the skin itself. At this point, some people put glue on the skin, some people just put a dressing. I personally favour putting a glue and a very special dressing over it that the plastic surgeons also use to try and get the best possible scar that I can for the women I'm looking after. And I think this is something that we all take pride in, trying to get really good scars after this type of surgery.